So you're all welcome to our webinar. We're going to just wait a few minutes or a minute or so that everybody can join us. So you're all welcome. We're just going to wait another minute as people are continuing to join us. So, good morning, afternoon, evening, everyone, and you're very welcome to this week's webinar, which is on palliative care and COVID-19, valuing and strengthening palliative nursing in the time of COVID-19. This webinar is being recorded and will be available shortly after completion. So my name is Professor Julia Downing. I'm the Chief Executive of the International Children's Palliative Care Network, and I'm a nurse, and I will be moderating the session today. So this webinar is the 11th in our series on palliative care and COVID-19, and the series has been developed jointly by the International Children's Palliative Care Network, the International Association for Hospice and Palliative Care, the Worldwide Hospice Palliative Care Alliance, and palliative care in humanitarian aid situations and emergencies. The objective of this series is to provide globally relevant information and guidance to civil society, UN organisations, policymakers, administrators and healthcare providers on palliative care in the context of COVID-19. The webinars are accompanied by briefing notes which have been written by experts from around the world, and these briefing notes are available on the globalpalliativecare.org website, and the webinars are also uploaded there and on the WHPCA website. So we are very grateful to the contributors of the series and also for today's presenters for accepting our invitation to participate in this collaborative project. This webinar will feature 3 15-minute presentations with time at the end for questions and answers. We will also have a short reflection from my friend and colleague Rose Chiwanuka, a retired palliative care nurse from Uganda who also has lived experience of palliative care, and she will share some reflections on the topic. Please do submit your questions and answers through the chat box, and Kate from the WHPCA will be reading these and putting your questions to the speakers. And we do encourage you to put your questions in the chat box as we go along. Don't wait until the end. So we've had support from a range of experts from around the world in developing the nursing briefing note. And it's been an interesting experience as we've learnt from each other during the process. And despite differences in national responses and resources, we have also identified some similar challenges. And many of the principles for us as nurses are similar in different settings. So I'm going to hand over to our first speaker, who is Dr. Julie Ling. She's Chief Executive Officer for the European Association of Palliative Care, and she's also the current chair of the Worldwide Hospice Palliative Care Alliance. She's going to be speaking about strengthening palliative nursing during the COVID-19 pandemic. But firstly, Stephen, if you could put the slide on. We'd just like to thank all of those who have contributed to the briefing note on leaving no one behind, valuing and strengthening palliative nursing in the time of COVID-19. So next slide, please, and over to you, Julie.
Thanks very much, Julia. As Julia said, I'm CEO of the European Association for Palliative Care, and I'm the current chair of the WHPCA. But also, I'm a very proud nurse. I've worked in hospice and palliative care for the last 30 years. And so I'm delighted to be asked to present here today. Next slide, please, Stephen. So no talk on nursing would be complete without a picture of Florence Nightingale. And 2020 is a very special year for nursing. 2020 is the International Year of the Nurse and the Midwife, recognised by the WHO and the International Council of Nursing. And it also is the 200th birth anniversary of Florence Nightingale. Next slide, please. You have to forgive me forgive me for indulging myself here. It's not often I get the opportunity to show a picture of Florence Nightingale and then show a picture of me, so I thought I'd take that opportunity. As you can see from the little picture on the side, I don't look like this anymore, but I actually am a nurse, and as I say, have worked extensively in palliative care, both in the UK and in Ireland, in policy. And I think one of the things about nursing is that it has so many transferable skills, and that we are able to work in so many different areas. So we can work in education, in administration, and obviously the route I've chosen is to go into management. So I think we should never forget how important we are and how all of those skills can be transferred to other roles and posts. Next slide, please. So at the beginning of 2020, how many of us could have predicted that we would all be sitting here now talking on a beautiful sunny day here in Dublin, talking about a global pandemic? We all started the year with the same hopes and expectations for every other year that we've had. So we thought we would have time with our family and friends, going to concerts, going to work as usual. But actually everything took a huge turn, and COVID-19 has impacted on every single aspect of our lives, from our social lives right the way through to our family, our friends, and indeed our working lives as healthcare professionals have been hugely impacted. And I think we shouldn't forget how we have actually come such a long way. And sometimes we could even think that it was, still February, but actually we've gone 4 months of lockdowns in various countries, and some of us are still going through the very worst of this. So what does it mean for healthcare professionals? So next slide. So nurses are the biggest proportion of healthcare workers, as we probably all could guess. So around 60% of healthcare professionals are nurses. So there's nearly 30 million nurses worldwide, and it's estimated that there are approximately 6 million nurses extra needed. So there's a global shortfall. The majority of these nurses are needed in countries where they're low and middle income countries, and in regions such as Africa, Southeast Asia, Eastern Europe, and also some parts of Latin America. So it's no surprise if we look and see that more than 80% of the world's nurses are working in countries that account for half the world's population. And I like to call it the nursing brain drain. And I think all of us are very familiar with this concept that nurses have followed, they've qualified in their own countries, in their own healthcare systems, and then more wealthy countries have attracted them for obvious reasons: higher salaries, better quality of life. And so there's this mass movement of nurses around the world, and the focus of the majority of nurses are in those countries that have the most money. And so, for example, I know many nurses from India and the Philippines have left their own country and moved to Europe to provide nursing care to in those nations. And so I was very interested last year when I was in Ukraine, and they told me that nurses' salaries are very, very low in Ukraine. And so their nurses move from, because they're not in the EU, move to Poland, and the Polish nurses are all moving further west. So there's this whole shift and movement of nurses, often leaving countries in most need with the least nurses. So I think it's really worth noting. Next slide. I also think this is no surprise that nursing is still a female-dominated profession, and globally 90% of nurses are female. And there's huge gender issues across nursing. I mean, there's inequalities in pay and promotional opportunities. And I think it's quite interesting that actually many nurses who are like the 10% of male nurses often are the ones who are in management and leadership positions around the world. And obviously that's all related to gender. And I think in 2020, it's surprising. I mean, many of us would have started nursing years ago when perhaps it wasn't such a big surprise, but certainly now in 2020, this is an issue that really does need to be addressed. Next slide, please. So it's great to hear Dr. Tedros from the WHO, he's the Director General, talking about nurses. And I think through the COVID crisis, nurses have really come to the fore, and we've come into our own. And as he says here, we've been the backbone of the health system. And he's talking about how it should be a wake-up call to the health system, that we get the support that we need. But it's not just support we need, it's, you know, we need recognition as well. And I think that's something that we really, really struggle to achieve. Next slide. So not only have nurses been at the forefront, nurses have also made the headlines for many other reasons. And as you can see from these headlines, nurses have really, really made a huge sacrifice. Many of them have contracted the virus. And as you can see, one of the headlines there is killed more than 600 nurses. So we continue to put ourselves at the front line. And obviously there's many reasons that have been discussed as to why so many healthcare workers and nurses in particular are dying from the condition. And I think, you know, we have to look at, you know, is it the adequate supply of personal protective equipment? It seems that some groups are more susceptible to the virus. So there's many, many reasons why this might happen, but it's also around being exposed to the viral load and other things. So I think nurses really have been front and fore in this, and not always in a very positive way, and with so many becoming infected and actually dying. Next slide. So an RCN survey in the UK looked at nursing and their views on working during the COVID pandemic. And you can see 74% were worried about their own personal health. And I think it's very telling that 92% were even more worried about carrying the virus to their own family members and the ones they loved due to their clinical roles. A third had anxiety and stress. Many were being redeployed, and 62% that they felt they hadn't been adequately trained to cope with their new roles. Over half worked over their contracted hours, and most of those weren't getting paid for that additional work. And I think this is another part of nursing that really needs to be addressed. A quarter said that they hadn't got the right PPE, and again, even though many said they had, I think the variability of that is huge. And I know I'm talking to a global audience, and I'm sure that all of you have your own stories around what's considered to be appropriate PPE and whether you have access to it. I think it's really important. I mean, I know I have friends who work in hospices and they're told there's only certain cases where they can wear full PPE, even if they don't feel comfortable. So I think it's an ongoing issue, both in wealthy countries and even more so in countries where they have limited resources. Over 50% of nurses said they lacked the confidence about infection control and prevention, and that they hadn't received the right training. And I think some of these things are universal. And then again, many felt that many said they had to miss shifts because they had symptoms or they had to self-isolate. So what did that mean for them as professionals? What did it mean for their pay, and so on? Next slide. So what did it say in the medical literature, particularly as it pertains to palliative care around the pandemic? So it poses a unique challenge. So challenge is often used as a euphemism for difficulty, but challenge doesn't always mean it's difficult. Challenge sometimes provides us with opportunity as well. So palliative care services came into their own, and that seemed to be a real feature of what is written. We didn't have huge capacity, but palliative care teams were getting respect and also being recognised in the medical literature, and that continues to be the case as more and more articles are published with quick turnarounds by the journals and their editors. Next slide. So who thought in their lifetime that they would live to see palliative care across the front page of the Lancet? And I think this is a huge moment for palliative care. That it needs to be part of national and international response plans is in no small part. This headline appeared on the 22nd of April and was in no small part due to the effective lobbying of the global organisations to have palliative care included. I just think it's a real landmark moment and great to see that we finally made it to the front page. Next slide. So in response to the opportunities and threats that I mentioned earlier, and the challenges, Julia Downing and I have just written this editorial for the International Journal of Palliative Nursing, and we really thought about what were the threats and what were the opportunities, and is a global pandemic was it a bad thing for palliative care? So I thought I'd maybe just go through some of the pluses and minuses in the next slide, please. So what opportunities did it present? I should say this is one of the photos that was submitted for our views of palliative care for the Berlin Congress. Someone said this represented palliative care. I think it's a lovely picture. So palliative nursing opportunities in COVID-19. So what did it give us the chance to show? It gave us the chance to show that we have really unique skills, that we're really good at what we do, that we have great knowledge, that we're competent and committed, that we provide a holistic approach to care. So we don't just look at the person in the bed, we look at their whole family and their social structures, and we think about their spiritual care and other aspects of care, which I think makes palliative nursing unique. We also have the opportunity to showcase this uniqueness and show that we're really innovative, and that when it was needed, we were able to step up and that we could help in this absolutely unprecedented time that nurses in palliative care had a role that others couldn't fulfill. We show we have the ability to deal with really complex problems and decisions, because in palliative care we do that a lot, and we do it on a daily basis. Sometimes they're not the biggest complex problems, but they are for the patient or for their family, and we help them problem solve. We have huge experience of dealing with families and breaking bad news. And during this time when patients were dying and spending their last weeks, days, hours and minutes on this planet without their families around them, palliative care nurses showed that we can be there and that we can help. And I know one of my board members who lives in northern Italy was telling me that she spent all day working clinically, but she'd arrive home in the evening and then she'd be making phone calls to families and helping them to break bad news. Obviously, we still at this point have no idea the extent of the grief and bereavement services that will be needed. And I think that's something that will be with us for a very long time. We demonstrated that palliative care is not a luxury. We need it for everybody. And I think we also showed that palliative nursing is an essential part of the response to COVID-19. And I think that's really important. Next slide. So what were the challenges? I think if you think back to the slide from the RCN, we can see that excessive workload was a problem, redeployment to areas where you needed new skills. So many nurses who were working perhaps in academia and who were working in non-clinical roles, I was even asked, and I know Julia also went back to the clinical area, that we needed to develop new skills and competencies. A lot of nurses were redeployed to the front line. The risk of infection, huge for palliative nurses, and not just infection for yourself, but to others, as we said. The lack of personal protective equipment was one problem, but the other thing is, was there adequate training on use? So you can see in this slide a picture of a nurse in what we would normally wear, and then looking at the PPE and even the whole practical aspects of gowning up, putting on your gloves and putting on your personal protective equipment requires training, and also to take it off safely so that you don't infect yourself and others. So that was a huge issue. As I said, return of retired workers to clinical practice, and also some really pragmatic challenges. So people were in lockdown and they had challenges getting to work, their place of work. How did they travel? Were they it caused them increased stress and expense, and also some nurses reported stigmatization of them because they were caring for people with COVID-19. People felt they didn't want to be in touch with them in case they too caught the virus. Next slide. So when developing this, and Julia touched on this earlier, we developed this briefing note. And actually, you can see from the list of authors that Julia showed earlier, we come from every corner of the globe, and we come from resource poor countries, we come from countries that are perceived as being wealthy, and but everybody was experiencing similar problems. The similarities were far more than the differences, and the whole being able to step up and make a difference was seen throughout all of our deliberations. And we obviously developed this briefing note online and virtually. So it was really interesting that so many people, and we agreed on so much. Next slide. So I'm sorry, I've even given you a stereotype nurse there, a lady. But anyway, the opportunity to strengthen palliative nursing. So what were our suggestions? Next slide, please. So our recommendations, and this is not to just UN member states and civil society organisations, it's to health service managers, it's to those that make decisions. We need to ensure that palliative care is seen as an integral part of all nursing practice. And we say it not just in a COVID pandemic, we say it all the time, that everybody dies. And doing that well is something we can help with. So we need to see it as an integral part of all nursing practice. We need to recognise the unique role of the nurse, and particularly in this COVID response, we need to make sure people have the right resources. PPE is just one of those things, and that's mentioned even specifically in the last point. We need to provide education and training to enable nurses to be competent to manage COVID-19, but COVID-19 encompasses palliative care. So there we're back again, more education, more training, more knowledge dissemination about palliative care. And we also need to provide support to nurses who are returning to clinical practice. And in some countries, you can't return to clinical practice unless you're registered, and you have to keep up to date. In others, people thought you were a nurse and you could just go straight back into the clinical practice. So I think we need to look at that too. Next slide, please. So our other ones were that we need to protect nurses from gender-based issues in the workplace, not just in palliative nursing and not just in a pandemic, but we need to think about this more. And maybe this is an opportunity as nurses, as Dr. Tedros said, are now highlighted as being the backbone of the health service. Maybe this is our opportunity to actually flex our muscles and let people know how important nurses are in the workplace. I also think this is really important, but this pragmatic stuff was a really big issue. Transport to work, to care for patients in the COVID pandemic, increased expenses for nurses, so we need to make it cheaper for them to get there or provide free transport. Are you at personal risk if you're going on public transport to work? If people work hours, if nurses work hours, we need to pay them, we need to value nurses, and that's a problem. And many nurses have an altruistic tendency where they think, well, it's my patients, it's my duty, it's my clinical care. But unless we let people know our worth, then we're never going to be paid for the work that we do. Nurses need to take time off work. We need time away. We need to care for ourselves, and we need to build our resilience so that we can go back and provide the very best care that we know we can. If we don't look after ourselves, we can't look after others. And also investment in training and jobs and leadership for palliative care nurses. And as women and as palliative care nurses, we need to have investment in us so that we become the leaders and that palliative care continues into the future. And next slide, please. So I'm going to finish where I started with Florence Nightingale. So as Florence Nightingale said many, many years ago, we should never let ourselves consider finished as nurses, that we must be learning all of our lives. And I think in some ways Florence might be preaching to the converted in palliative care, where many people, regardless of their global location and their location of work, palliative care nurses, many of them at their own expense and in their personal time, do develop themselves. They do. I mean, we have many of you on this call today listening to see what you can learn and how we can develop as palliative care nurses, because we're always keen that we can actually learn and end up providing the very, very best care that we can for people in those last months, days, weeks of life. And I think that, you know, as palliative nursing, we need to be valued. So I'll leave those last words there of Florence, and it's all about learning and training and developing ourselves. So thank you very much.
Thank you very much, Julie. And thank you for presenting some of our recommendations from the briefing note. Just a reminder to everyone, please, we'll be taking questions at the end. So please do put your questions in the chat box, and ideally copy to everyone so that we all know what questions have been asked. So I would now like to welcome our next speaker, and it's great to have our colleague Lin Kwok Yin Molin with us. She's the Director of Professional Services from Butterfly Children's Hospices in Changsha in China. And she's going to be sharing their experience of palliative care nursing at the time of COVID-19. So over to you, Molin, and thank you.
Thank you, Professor Darling. Good morning or good evening to everyone. I am a pediatric palliative care nurse for over 20 years. The first 18 years I worked in Hong Kong, and the previous 2 years I started work for Butterfly Children's Hospice in Changsha, China. It is my pleasure to share with you my view of the roles and importance of palliative care nurses in the time of COVID-19. COVID-19 has brought a tsunami of suffering that is devastating even well-resourced countries. COVID outbreak is an emerging, rapidly evolving situation. The characteristic of COVID-19 as follows. It is acute and highly infected disease. It can be life-threatening, and we now know that older people and people with chronic medical conditions such as diabetes and heart disease appear to be more at risk of developing severe symptoms. As this is a new virus, we are still learning about how it affects children. COVID-19 can progress rapidly and fatal. Some patients will need ICU care during end of life. A lot of distressing symptoms occur at this stage, such as breathlessness, coughing, nausea and vomiting, diarrhea and bleeding. Physical and social isolation brings a lot of practical difficulties and psychological distress. Since this virus is new for healthcare, we are lacking of knowledge, experience, and resources to treat this infectious disease. The long-term side effects for survivors are still need more studies and monitoring. Since COVID-19 caused many deaths, the need for grief support for patients and families are huge, especially there may be multiple loss happened in one family. Next slide, please. A small and simple survey has been conducted in previous week. The sample number is small since the time for preparing this is running out. And actually, the population of palliative care nurses in China is small since the palliative care service is still underdeveloped in China. This survey is mainly to review the perception of the Chinese palliative care nurses on the roles and importance of palliative care nursing during COVID-19. 50 nurses who are working at either palliative care or health business setting responded to 10-item questionnaires. Only 6 of them had the experience to take care of COVID-19 patients. Fortunately, majority of the nurses has not been redeployed to other areas. 39 of the respondents replied the palliative care nursing is very important. 7 replied it is quite important, and 4 replied no comments. 18 respondents had the feeling of helplessness at their work during the pandemic. Next slide, please. The nurses who replied the palliative care nursing was important because they thought that the role of nurses are crucial and diversified. I summarized the replies from the nurses. They thought that nurses are a carer. Since the patients have been isolated, nurses become the important carers of the patients. Daily basic bedside and hands-on nursing care is relied on much on nurses. Because of their distressing symptoms during end of life, comfort care is emphasized. Nurse is a listener. Patients who are suffering from COVID-19 will experience a lot of physical, psychosocial, and spiritual distress. They are anxious about the distressing symptoms and the unknown prognosis. They are fear of infections and going to die. They will be depressed on the prolonged treatment and the sufferings. They feel lonely because of isolated situation. They may feel angry for being infected. All these feelings should be acknowledged and being attended. Nurses are one of the only persons can approach them closely. Thus, nurses become an important listener for allowing patients ventilation and then attend their feelings and provide support. Nurse is an information provider. Nurse play a very important role to provide information such as breaking bad news for patients and their families. Nurses are also the bridge of the information exchange. Since the patients cannot be visited, their family members will be very anxious about patients' conditions. Nurses can help the patients connect their families with the support by using virtual communications such as telephone, WhatsApp, video technologies to update patients' condition and disease progress. This should be very, very helpful for stress relief. Nurses can be more creative in many aspects to improve the quality of care during this pandemic, since this is the new experience and majority of people did not experience such situation before. Nurse is a facilitator. If nurses are the close carer for the patients and know the conditions of the patients, nurses can find the right time and facilitate the discussion about advanced care planning with the patient. It is important to seize the opportunity to explore the feelings and expectations of the patients and discuss with them about their care plan and their decision on resuscitation when death is inevitable situation. Nurses play an important role to facilitate all kinds of communication amongst patients, physicians, allied healthcare workers, and families. Nurse is also a coordinator. Palliative care nurses are always case managers. She can coordinate the palliative care team, other healthcare workers, and all available resources in hospital and community. Nurse is also a companion, especially at the patient's end of life. Since the patient needs isolation during COVID treatment, when the patients are at the end of life stage, nurses become their companion as a friend and family members to alleviate their loneliness and fear. The support from nurses for these patients are extremely crucial. Next slide, please. The importance of palliative care nursing is due to the characteristic of COVID-19 and the main elements of palliative care. Palliative care is patient-centered care. It emphasizes enhancing quality of life and good symptom management, promoting affirming advanced care planning that takes account of the impact of COVID-19 infection on the patients and their family. Ensure advanced care planning developed using open communication in an empathetic manner, which incorporates and acknowledges the views of the patient and the caregivers. Try to fulfill patients' wishes and balance the pros and cons of the treatment. Sometimes cultural issues are also considered because some COVID-19 patients may be from foreign countries. Palliative care is holistic care. It embraces physical, psychological, social, spiritual elements. For life-threatening illness such as COVID-19, the patients need care on these four aspects. When the patient's final goes into the end of life stage, he will have a lot of distress symptoms. For example, enough supply of opioid is key in symptom management. Facilitate the communication during isolation and allow saying goodbye seems difficult but extremely important. for the deceased and the patient and the family. Since the outbreak is sudden and the disease can progress rapidly, good anticipatory grief support and bereavement care for the families is also important for family to reduce the risk of traumatic grief. Next slide, please. Because nurse is human and nurses are the large group of healthcare workforce in the healthcare system, how to take care of the nurses to retain the manpower to be attended. Nurses need holistic approach care too. Ensure the availability and rational use of personal protective equipment and keep them up to date with available evidence and experiences of others in caring for COVID patients is the basic support for frontline workers. Enough rest can keep the good immunity system and mental state of the workers. If the nurses need quarantine after work, the pace for quarantine and the transportation to work should be considered and provided by the employers. Reasonable pay for overtime work is a motivation and also an recognition for the effort they paid. The 18 respondents from the survey who said they felt helplessness because they have fear, the fear aroused by the highly infectious and sudden onset disease, large number of patients and deaths in short period. The nurses are the person exposure to so many unmet needs for symptom control and palliative care. Some helplessness can provoke emotional fatigue. Therefore, provision of debriefing session and allowing ventilation should be very helpful for the nurses. Such challenging situation and facing so many sufferings and deaths may trigger nurse spiritual distress. Provision of spiritual support channel, service channel for the frontline staff should be the concerns of the employers during the pandemic time. Next slide, please. In conclusion, it is always not too late to review the importance of palliative care nursing in healthcare settings and the importance of life and death education for the public. During the COVID-19 pandemic, access to essential palliative care at end of life, including bereavement support, is limited in the face of high demands in all countries. In view of this reality, provision of palliative care should not be only the job of the palliative care team members. Expand all nursing and other healthcare worker curricula to include core palliative care competencies in pain and symptom management, end-of-life conversations, and also the comfort care is very important. As the briefing note mentioned, ensure palliative care is seen as an integral component of nursing practice in any settings, so that all patients can have basic palliative care and the healthcare workforce would be more prepared for this pandemic. Establish standard and resource stratified palliative care guidelines and protocols for different stages of a pandemic and based on rapidly evolving situations and scenarios, so that its value and pace in high fatality humanitarian crisis can begin to gain practical traction and acceptability. Clearly defined guidelines on palliative care would also let training and dialogue on palliative care in contexts where staff have no previous experience treating patients with COVID-19. Address the needs of nurses for support that I have discussed before. Next slide, please. Let me quote one statement from a palliative care nurse who was the respondent of the survey before I finish my presentation. She said, palliative care should go deep into everyone's daily life. Otherwise, there will be too much helplessness when the epidemic comes. I can't agree with her more. Thank you very much.
Thank you very much, Marlene. And I think it's really fascinating to hear your input from a survey in China, and Julie had mentioned the survey in the UK. And we can see there's some similarities across there. And one of the key areas I think that has been highlighted is the importance of education, mentorship, and support. So just a quick reminder to put your questions in the chat box as we go along. And I'm going to now invite our next speaker to come and speak to us. So our next speaker is Professor Regina Silz, who is Professor and Dean of the School of Nursing at the University of Sao Paulo in Brazil. And certainly from the news that we've been hearing, we know that Brazil are having many challenges with regards to COVID-19 at the moment. So we are very grateful, Regina, that you've had the time to come and share your thoughts with us, particularly looking at palliative nursing education in response to COVID-19. So thank you very much, Regina, and over to you.
Thank you, Julia. So my part is, next slide, please. My part is to emphasize the urgent need to invest in education, training, leadership, training for palliative care nurses, outline new challenges for palliative care education in COVID area, and outline the reason for establishing appropriate training to strengthen the palliative care knowledge and skills of all nurses in the context of COVID. Next slide, please. I can continue this presentation without mentioning again this year of the nurse and the midwife. The spotlight is finally beginning to shine through the cracks and highlight then ending dedication and perseverance and struggle of nurses and midwives around the world. In a sense, this was prophetic, as it was chosen long before nurses and other health workers were thrown into increased proeminence and, yes, change for the pandemic of COVID-19. Next. Common reaction to COVID-19, especially for old people in palliative care, some of them were already presented, but I just want to highlight here concern about protecting oneself from virals. They are higher risk of serious illness, concern that regular medical care of community services may disrupt due to facilities closures or reductions in services and public transport closures, and feeling socially isolated, as someone mentioned before, and guilt if loved ones help with activities of daily living. Next slide, please. So during the pandemic, however, as death and dying become the focus of our day-to-day, the emphasis for having this discussion and comparing our end-of-life care preferences may be brought to the fore. So previous barriers such as not perceiving death as imminent or difficult anticipating the future may reduce at this time, as we have these in TVs all the time. Next slide, please. So palliative care education is often lacking in graduate nursing education curriculum. Studies show that many nurses are uncomfortable discussing end-of-life issues with patients and providing palliative care to dying patients and their families. Trained palliative care workers build an organic example of compassion community process at this moment. Next slide, please. So we have a new challenge for palliative care. Julie presented already some of them. It is our practice to enter patients' rooms as a team and hold family conference in patients' room. In the context of highly contagious illness like COVID-19, it makes sense to limit providers who have direct contact with the patients to the bare minimum. Common community management and support for grief will require new approach within the context of is associated with higher level of complicated grief after death. So families are not receiving the best attention and an explanation at this situation because of the isolation that is necessary. This will impact on how people process their grief and may have lasting consequences after the worst the pandemic has. Unique challenges for palliative care. As I said, discussions about the end of life usually benefit from relationship building between healthcare professionals, patients, and families. Current may limit communication between all parties. Professionals engaging in difficult conversation often rely on verbal cues to facilitate discussion of sensitive subjects. However, telephone conversations hinder this, and some people may not have access to or skills to use technology such as video calling at this slide, please. So this is the point to invest in education and leadership training for palliative care nursing. It is important nursing students to understand that palliative care is not a binary decision, but a conversation that opens up alternative and just as important types of care. Adopting a palliative approach is not denying care, but means a person receive a more holistic and person-centered approach that is keeping with their previous wishes and may maintain comfort, quality of life, and insurance a good death in this situation. Provide education and enable all nurses and students to acquire adequate competencies for the management of COVID-19 is really important at this time. Next slide, please. So how to prepare for nursing students in this context of scarcity? Brazil has become the second country in the world to confirm more than 1 million cases of COVID-19, and disease continue to spread. Starting on the end of March 2020, a 900-bed facility of the Central Hospital of University of São Paulo was exclusively designed for inpatient care of suspected and confirmed cases of COVID-19, admitted after referral by state-wide systems. Other clinical conditions were transferred to other institutions on COVID. The institutional plan was to keep students off the front line, considering the need to avoid their infections with coronavirus, the overburdening professionals directly involved in COVID-19 care experience. We limited their tutorial capacity, supervising students in clinical. The model transfer PPE for professionals actually. Nevertheless, the opportunity to bring students on board in this exceptional epidemic scenario should not be missed at this time. As highlighted, as Khaled in a recent paper, enabling safe and effective deployment of students in clinical arena in this unique moment should be our responsibility as nurses, educators, in clear demonstration of civic moral education and During this School of Nursing in partnership with the COVID-19 Crisis Management Committee of the hospital, the Central Institute, conceived a comprehensive portfolio of activities students could voluntarily undertake at this moment. So now we will describe how University of São Paulo Nursing School, how our students were invited to contribute to the institutional response to the pandemic, taking responsibilities within their level of competencies depending on previously acquired skills and willing to participate in this scenario. Nursing students started to work in these recently regardless facilities, sites regarded as of low exposure to coronavirus infected, being thus able to continue their training program. An application platform was created describing the specific aims of students' requirement and detailed duties expected from participants of activity activity for students to identify what suited them best, them securing these situations. A particular concern is in this environment was to determine to what extent nursing students should be as monitored on alternatively invited to integrate institution effort in response to the epidemic, ensuring safety and supporting their doubts and anxieties, having to face the unpredictable course of potential life-threatening contagious disease was crucial. We were confronted with the ethical doing no harm, keeping nurses, students away from clinical setting where interactions with COVID-19 patients, palliative care patients was expected, or responding to their willingness to contribute somehow in such a public health scenario. Next slide, please. So leading by example and demonstrating good, this picture, so we have one nurses that was there, students leading good, and it was really powerful education tool for us, provide education and training that enable all nurses, all students to acquire adequate competencies for management COVID-19, including prevention, functional assessment, goal, end of life, advanced care planning, and so on. This opportunity includes numerous tools that nurses can use to improve the care of patients they serve. For example, Vital Talk was one of the tools that they could use in this situation. So preparing students for how to handle negative emotions will be in this context, in particular encouraging students to express empathy and acknowledge emotions by calling them out when patients and families express strong emotions can sometimes help diffuse it. Next slide, please. So in this experience, they could follow the admission, assessment, treatment, end-of-life care, discharge, transfer patients. And I need to say the most important thing that they could follow here and practice more is the effective communication. It was really, really an important tool because of the special conditions that we have in these situations. Here we have an example of virtual visits using video call. Good communication still remain important to engage with families in this situation. And to communicate well using videos, students need to pay attention and should set up equipment to allow eye contact with the family to strengthen rapport. And again, not everybody have all these equipments available to have this opportunity to visit families, visit the patient in this way. Next slide, please.
Regina, you just...
Here another example of discharge the patient. Slide, please. Next slide, please. Here is an example of the robot. So the students have the opportunity to train the robot and this during the break. Next slide, please. And here an experience of how they could give support to families by video, especially with children, and talking and territory and that. Next slide, please. Next slide, please. I can already, you can go, Steve, please. Okay, so they have this other opportunity. Goodbye, providing brief and discuss the urgent need for advances directive. And the last one, please. So the lesson learned from this 2 months, it is imperative that policymakers, nurses, educators, organizations provide of these situations of palliative care nursing as they want to, of course, in this situation, have a lot to understand and to help in this context of COVID-19. Thank you very much.
Thank you very much, Regina, and it's really interesting to hear how you and the department responded to this challenge. So thank you. We've been hearing about the importance of education, the importance of leadership, in well with this year being the year of the nurse and midwife, with the Nursing Now and the nurse leaders. Hopefully we can build on this momentum and opportunity from COVID. So I'd now finally like Rose Chowanu to share a few reflections with us. So for those of you who don't know Rose, she was the first palliative care nurse in Uganda, working with Dr. Anne Marion, and has lived of palliative care for a few years as well. And she has a wealth of experience and knowledge on palliative nursing. So Rose, if you can give us in 5 minutes some reflections on your thoughts. You're still on mute, we can't hear you.
Yeah, you're right. Now,
yeah.
Thank you very much, Dr. Julia, for giving me the opportunity to share my experience as a first palliative nurse in Uganda. Initially, I worked in a mission hospital as a in Hospice Africa, Uganda, and learned initially on the job. But I want to say that palliative care nursing is very, very vital. It makes us a whole, it makes you a whole nurse. Nursing is an art as well as a science, as we all know, geared to nursing. But when you get palliative care, you really become a whole nurse because you're able to look at somebody holistically, as somebody said. So nursing is very, very important. And I would like to say that palliative care has helped us in Uganda to see many patients. And this has happened because palliative care has spread to different parts of the country. And in COVID-19, people have realized the importance of palliative care, although initially we were not on board. PICAO did a lot of advocacy to make sure that palliative care nurses are brought on board, and now they are on the COVID-19 national team, kind of supporting the others to see that palliative care is actually provided. But I want to say that that would not have been possible if we did have in Indiana Center for Hospice Care to train as many nurses as possible to provide the services. But also I would like nurses to become palliative care nurses, and now palliative care is in the nursing, but also it has become a specialist course for nurse. Government school took it on and started training nurses in advanced diploma in palliative care nursing. And I want to say that palliative care is needed all round, because in this COVID-19 era, you can see that these patients need to be taken care of holistically. They have all sorts of pain in different areas, and nurses, palliative are well placed to take care of these patients. To say that I also benefited from palliative care nurses. When I was teaching, when I was caring for the patients, I never expected that I would be a patient myself. And now I can testify globally that I benefited from palliative care services, and anybody can get these services at any time. And that's why we need at least all nurses to have palliative care knowledge. And when these nurses have the palliative care knowledge, it becomes easier to support patients. Because I can remember when I got the disease, the cancer myself, somebody should say that, but she was already a palliative care nurse, so she knew everything. I was a patient. And I want you to know that when you become you cease being a nurse, but you become a patient. And things are so new to you. You talk of denial, and maybe one would say, a nurse, she's knowledgeable, how can she get into denial? But you can get into denial to overcome those challenges. And I would say that wherever we go, and I would encourage all governments globally to encourage their Ministry of Education to make sure that palliative care is taught to these nurses. The doctors, our partners, also need to know palliative care to be able to make patients feel comfortable wherever they are. That's what I can see, Julia.
Thank you very much, Rose. And you kind of brought us back in a nice circle in a way, because one of the pictures that Julie put up at the beginning was, unfortunately, the number of nurses who have got COVID, who have caught COVID. And then you talked about when you're a patient, and needing that support from
Yes.
palliative nurses. And I think in these presentations, we've touched on a wide range of things around advocating for nurses, around providing care for patients, around providing care for nurses, self-care, etc. And I can see through the chat that there are a lot of questions. So I'm going to hand over to Kate from the Worldwide Hospice Care Alliance to ask our panel some of these questions.
Thank you very much, Julia, and just a big thank you to all the presenters, and especially to Rose for those very insightful reflections. We have the role of nurses as end-of-life companions. So the participants said that they were struck by nurses' roles as end-of-life companions during COVID, when family, friends, and other loved ones cannot be present. How do we reconcile and prepare nurses for this role, given usual emphases on professional bodies?
Who wants to tackle that one? Julie, I can see you're smiling.
Yeah, there's some very difficult questions there to answer, really. I think it's not normal. Warning now is not normal. It may sound obvious, but people are finding themselves in, everyone is learning as they go. It's not a normal process. And you're caring for people in a specific setting where you're expecting them to die and you have their family around them, or you actually are able to ascertain their advance, that is far more important. So you know, okay, the wife needs to be here, this person doesn't. So, but I think in the absence of any of that, I suppose one lesson that we all need to learn is that we all need to talk about our wishes more. So people are dying in these abnormal and completely strange circumstances, and quite often the person who's caring for them doesn't know their wishes, and in fact probably the person who's dying doesn't know their wishes because they've never spoken about it. So maybe we need to take it back, and that's a lesson learned, that we need to talk about advanced care planning and about getting the conversation about death and dying into, maybe that will be an outcome from this pandemic, is that people will start to say, these are my wishes. In the absence of family and nurses, not just nurses, healthcare assistants, doctors, everybody is taking the place of family and friends. So I think one of the most distressing things for families is the thought that their loved one died alone, completely alone, and with somebody with a big mask on that they couldn't see, that they didn't have the touch of flesh on their hand. Now, obviously, there are some patients for who are not even conscious, so they're not sure if someone's there. The nurse is there in the room with them. So there's a lot of issues around that. So it's almost communicating how that happened to family. And this answers some of the questions that were asked after that. I think there's a lot knowing. People want to know, well, what actually happened? How did that person die? How did my dad die? So I think as nurses, there's even more pressure on us if we're there with the patients. We almost have an obligation to relay what happened to the family, because otherwise they will have complicated grief and bereavement. And this is, as we know, it's not a sprint, it's a marathon. Grief and bereavement go on for a lifetime. And if we don't get it right, that can be a really big issue. So I think there's lots of things I read about people being with people when they died, and even having a photo of themselves on the front of their PPE, so that they, even though they couldn't show their face, people could see who that person was. I know here we had a really sweet little campaign where people were knitting 2 hearts, and the nurse who was with the person who died put one with the person who died and gave the other heart with a little card to the family saying, my name is Julie, I was with your mum when she died, these are the people that were in the room. And so just to give some of that feedback. So I think I've gone off question a little bit, but I think what the biggest thing to stress is completely abnormal times, and we have an obligation to help families to deal with this in the best possible way they can, and to get through their grief and bereavement in the best way they can. And I think we have to take time. It's a long process. We have to acknowledge what happened. We have to encourage advanced care planning going forward. And we don't know if there's going to be a second wave of coronavirus. That seems to be the thought. So is now the time to get that conversation going? Make people start to think about where they would like to be and what they would like to be doing at that time. With COVID as well, will everyone continue to die in the same circumstances? Will people with COVID be cared for at home? We don't know. Everyone was just rushing to get things to the best state they could because we didn't have time to plan for this. But for a second wave, we have time to plan and time to influence. I've gone off question. Anyone else is welcome to answer.
I'm just going to add something. I think, as Julie said at the beginning, I'm helping out in the local hospice during the COVID crisis. And so I've had some experience recently where I've had emails from patients' loved ones and been asked to read them out to the patient just before the patient was dying. And that was I found that particularly moving. And I also found it a privilege to be able to do that, to be there with the individual as they were dying, but also to be able to share some thoughts and comments from the loved ones. It was also hard to do, but it was a privilege to do that. So yeah, Lots of things to think about, and how do we provide the support and care for nurses who have been in that position.
Yeah, I was just going to add that, Julia, can I say something?
Yeah.
I was going to say that is really very difficult, because when a patient is dying, that is the most special time for that patient and the family, and the patient dying on his own or her own. It is so traumatic. Even to the nurse, a lot of information, asking them a lot of things, and they cannot easily pass on this information to the relatives, because the relatives have not come to visit the patients. I must say that it is difficult. Even the nurses themselves and care to be able to go through those difficult times. As somebody said, you can get burnout through this compassionate care. And our palliative care nurses are really at the forefront. They want to do everything. Like in Uganda, they're even going on in-home visits without enough protective gears. But because they have the care for these patients, they end up going there with the limited protective gears. So it is really hard.
And I think the long-term implications of COVID-19, both for families, but also for us as nurses, whether we've been caring for individuals with COVID or not, the impact has been across the. Another question.
Thank you. The participant wanted to hear more about some of the specific challenges that nurses working with pediatric patients and their families might be experiencing at this time of COVID.
Who would like to put in?
I think in this special time for the pediatric patients, because the mortality rate for the children is not so high, the health experience is that no children died for COVID-19. But in some way, many pediatric patients has been affected. Of course, they are affected by the pandemic, because they avoid to be admitted to the hospital, so that the parents want their children to stay at home. So that I think for the palliative care nurse is difficult, because they cannot visit the patient, and also because all the majority of essential admission has been delayed and postponed. So that how to communicate with the family is very important. Now we are well used the telemedicine and the video and the virtual communication, always to ask the patient's condition through the telephone or now how to connect my patients in the China. I only can use the video or the WeChat, use all these digital communication technologies to support them and to provide the service.
And Malena, a Butterfly House, I seem to think, I might have got this wrong, but I seem to think that the nurses, the staff were kind of working for 2 weeks at a time, and then going home, having 2 weeks at home. So that was extraordinary measures by the team to keep the children safe.
A month, so that 15 days, a group of staff to work for a half month, another group shift, another group, and the next 15 days in the month. So that all the staff locked down in the Butterfly home, and they work 24 hours and stay together in the Butterfly home. So that I support the nursing staff. I use the video conference, also the WeChat to support them.
So they were basically working 24 hours a day for 2 weeks, and then they'd
because two nurses inside, the bedside home, so they can shift.
So I think that's an example of some of the extraordinary measures nurses have gone to keep their patients safe.
Yes.
Okay.
So the next question comes from person who I know experienced palliative care as a parent in Ireland for her daughter, and she asked, she said it would be of such great benefit for patients and parents if general medicine had core training in palliative care. How are palliative care organizations utilizing the increased interest in the sector now during COVID to ensure this happens going forward? Second part of the question is, how are countries or World Health Organization being lobbied on the importance of investment in and inclusion of palliative care now?
Who would like to tackle that one? Julie, you're shaking your head.
I'm thinking.
Oh, we can't hear you, Julie, but Regina, you're off mute.
Yeah, I can speak a little bit about this. I think we are at the right time to do this. I think people, other nurses and also physicians and all healthcare providers are looking for us now. They are looking for palliative care teams. They need our help now. At least here is happening in Brazil. So now they are recognizing the importance of palliative care in this situation, that you need keep going with the communication, keep giving this bad news all the time. So we could, at this time, we could do some protocols inside the hospital, even for people or for healthcare providers that are not specialized in palliative care.
Okay. And thank you, Regina. Julie?
No, I was just going to say that I think probably the global organizations have done more about lobbying, maybe something about the WHO and what that means for nurses and what that means for palliative care.
So, yeah, I mean, thanks, Julie. So before COVID, we had with the organizations, so IHPC, WHPCA, ICPCN, we had submitted to have a side event at the Assembly on palliative nursing, and that was before COVID happened. Then COVID happened and the World Health Assembly was just a shortened virtual meeting, but there is potentially going to be a face-to-face or a meeting later in the year. And our understanding is that our side event palliative nurse has been approved and accepted. So we're hoping to have an opportunity then really talk about the importance of palliative nursing at the WHO, at the World Health Assembly, with the WHO, with some of the countries that are there, trying to get as many people to that side event as possible, and trying to build on the advocacy for palliative care and particularly palliative nursing. Much has been done, with the year being the international year for the nurse midwife, with pain. So a lot has been on the emphasis of nursing, and we were trying to build on that for strengthening our advocacy for palliative nursing. And I think the COVID situation has just probably strengthened our case, and will give us more power, if you like. But one of our challenges is reaching out and getting nurses at the top level within our governments, within our national systems. I don't know, I haven't done a survey, but if you looked at countries when they had the governments talk about how many times has a senior nurse been talking about COVID? It's probably a senior doctor, minister. So we need to build on our general advocacy for strengthening nursing and hopefully palliative nursing. So Sharon, we are working on it, and we need to take up one of those opportunities that Julie mentioned earlier within the COVID and bring it to a positive in enabling us to advocate more for nursing and palliative. Kate.
Thanks, Julia. This question is for Rose. From your experience as one who has been at the forefront of palliative care advocacy, but also one who has the lived experience of a person with palliative care needs, the first part of the question is, what is your message to some nurses who hesitate to take up leadership roles and stand out? The second part is, what is your message to some of the other healthcare workers and maybe policymakers who do not necessarily show great respect for the nursing profession?
I will start with the second part. Thank you for the opportunity. Those people who don't respect nurses, palliative care nurses, I think in my life experience, I've seen that I've encountered those kind of people whereby they would not respect palliative care nurses, but the day they get a patient, and then the patient requires palliative care, and the palliative care nurse provides the care and makes that patient comfortable, that's when they realize that palliative care is important. I'm not praying for them to get patients, but I just want them to understand. And we've used people like that who didn't respect palliative care nurses, later on got the experience and become the advocates, and they've make us understand the importance of care. Nurses who take the leadership, that person, because nurses who have care training, most of them have leaders in of work. Challenges as leaders and needs from care, other palliative care advocates and practitioners with their leaders to make sure that that nurse is helped to stand up and provide palliative care services, but also advocate for, as I said, we are lucky in a way, is in the curriculum, is in the medical curriculum, be a specialist course. They are suppressed. When they are budgeting, they are not budget. Has have support. For instance, the Palliative Care Association of Uganda has been working on a standalone palliative care policy for almost now, I think, 6 years, and it is still stuck somewhere. It cannot come out to for the nurses to use. So we still have some work to do to advocate for palliative care. Uganda is better off, but other countries are even in worse situations.
Thank you. I think we've got time for one more question, Kate.
Thank you, Julia, and thank you, Rose, for that very interesting answer. The last one, because we've had quite a lot of questions about bereavement. The question is, how can we be prepared for the abnormal bereavement after this pandemic? And then how can chaplains or spiritual care staff best support nurses during this outbreak, and then hopefully to address the trauma and grief in a post-COVID world?
Who would like to tackle that one?
I suppose the thing is, everyone's so concentrated on the here and now, and I do believe there are several organisations that are thinking about this and the impact it will have. And I know here in Ireland we have a national hospice organisation, and that's been their sole focus. And I think one of their little key phrases is that compassion trumps policy and procedure. So I think people, when they're bereaved, need compassionate care. I think in the long term, people will need support, and whatever guise that comes. So I think at the moment it's all about cure and medical care and finding the cure, but actually the people who are bereaved are going to be the very difficult ones. I think nurses working in palliative care will have a role in this, but more so it'll be perhaps, it can either be neglected if there isn't the resource. So maybe that's where we need to focus some of the resources, or any. And then I also think, you know, we do have a lot of really good skills in dealing with grief and bereavement within palliative care. So again, be a role where we could take on some of that. But I mean, to be honest, I just think that there's going to be such a huge and overwhelming amount of grief and bereavement out there. If we think how each death impacts a whole family, and the number of deaths is enormous. So I suppose it's coming back to learning from the past, and again talking about the future. So what are your wishes, and letting people have conversations about those end of life things, and making sure that also we haven't had the chance, I'm sure most countries are exactly the same, to celebrate people's lives through the rituals of funerals and so on. So maybe there's a role in some of this going forward, that people are developing these support lines. I know we have helplines here in Ireland, there's helplines, and I think there's lots of big not-for-profits taking on those roles. But what does that mean for countries where perhaps more scarce? Well, there may be learn from the countries that are doing that well, and we can spread good, I think. And also I think we cope with it, that compassion and through the personal experiences.
To a close now, but I think one of the important things is about learning from each other. Those who experienced the harsh realities of Ebola just a few years ago, and how they are coming to terms with all that has meant, learn from each other in different places. There's so much that we can learn from each other. And, I get excited about nursing. Any opportunity to talk about it. Important that we remember as nurses that we work as part of a multidisciplinary team, and that together we are working in this COVID pandemic, and we can support each other and help each other through all of the unknowns that we are facing. There's been things that have come up around COVID-19 and palliative nursing, and there's sort of carried on with questions for a long time, I think, about and from each other. How prepare at a difficult time, and how do we as so I think I was going to hand over to Stephen to talk about next week's webinar, but he's having internet connection problems. So I think next week the session is going to be on advocacy, and Catherine Pettis has been putting things in the chat box about the difference between lobbying and advocacy and how we can stand up, and there's been many questions around how do we advocate and join our webinar next week to learn more about how we can advocate for palliative care, particularly. Thank you today. Please do join us again next week. I'd like to thank Regina, Molin, and Lee Rose for their input and excellent presentations today. And on behalf of the Global Palliative Care Organisations, I'd like to thank you all for being part of our discussions today, for all that you are doing within palliative care, and in particular at this time of the COVID-19 pandemic. So please stay well and keep safe. Thank you and goodbye.